there. Happy Monday, happy Indigenous Peoples Day, happy Columbus Day, if that's the way that you celebrate today. But in any case, thank you so much for joining us for this conversation. We've been convening a series that we've called the Equity Series, which has been a series of conversations about important work that's taking place within city government and in partnership. And today we have a really special opportunity to talk about an important new initiative, the Quiet Care Campaign, which has come about recently, and we have some folks from the city and some folks that have been involved with that to talk about it and explain it and talk about why it's important. I'm really looking forward to this conversation. So thank you if you're joining us live or seeing us on the internet after the fact. We have two ASL interpreters with us today. You will see them at different points throughout the broadcast. What I'd like to do is get started with a round of introductions. My friends, what I'd like you to do is just say your name, your role, your organization, and why you're excited about this conversation today. We'll start with Alaa.
Hey everyone, good afternoon at this point. My name is Alaa Mohamed. I am a policy coordinator for the Office of Mayor William Peduto's Office of Equity. And I'm just excited to have this conversation and talk a little bit about the really great work that this group of people have been doing for the past several months. And I'm going to hand it off to some of those great people.
Thank you, Alaa. Dr. Cathy.
Hi, my name is Dr. Cathy Sigmund. I am the Director of Behavioral Health and Community Wellness at Northside Christian Health Center, as well as clergy with Allegheny Center Alliance Church, where we have Embrace Global Care Network.
Thank you so much, Dr. Cathy. Siraji.
Hi, my name is Siraji Hassan. I'm the Executive Director of a nonprofit organization called United Somali Bantu Greater Pittsburgh.
Thank you, sir. And last but not least, Benoit.
Hello, my name is Benoit at Kiumbu. Feel free to call me Ben anytime. I'm the leader of the Congolese community of Pittsburgh, which is a nonprofit organization as well.
Thank you so much. So I'd like to start with you, just with some framing. We work together in the Office of Equity. I run the My Brother's Keeper initiative, and you've been involved with Welcoming Pittsburgh initiative as well, with Faye, as well as with the policy team. We've talked about some of that work in previous conversations. This is a little bit different than conversations we've had in the past. So in your own way, tell us why we're here today and what we're going to talk about.
Sure, thanks, Josiah. So like Josiah said, I work with Welcoming Pittsburgh initiative, which is an initiative of Mayor William Peduto's immigrant and refugee inclusion work. And today we're here to talk about some of the work that's been done over the last few months to provide some culturally sensitive COVID-19 education. A few months ago, as everyone is well aware, COVID-19 broke out. It was a global pandemic, and governments all over the world shut down. But just because the government tells you to do something doesn't mean that people do it or that people understand why they should do it. And so the importance of grassroots efforts to help people understand what is happening and why it's happening, especially in our case amongst people who are maybe distrustful of government or people who have been through a lot worse, believe it or not, than a global pandemic. So a few months ago, during one of Welcoming Pittsburgh's community calls, we actually had some members of the United Somali Bantu Community Association, as well as the Somali Bantu Community Association, come on and talk a little bit about some of the problems that they were seeing in their community related to COVID-19, specifically in Northview Heights. At the same time, Mohamed, who is the previous executive director of the Islamic Center of Pittsburgh, currently with the Pittsburgh Foundation, was hearing the same things and decided to bring a group of people together. Many of them you see on this call, some of them you don't see on this call. So we brought together Welcoming Pittsburgh, Northside Christian Health Center, who's represented here by Dr. Sigmund, one of the local refugee resettlement agencies, JAPO, as well as a few other organizations to help us curate a campaign to target COVID-19, culturally sensitive COVID-19 education in the Northview Heights region specifically, as far as this group's effort goes. And that's how we began convening and talking about what we could go about doing to pursue that kind of education in this area. But I think Dr. Sigmund can talk a lot more eloquently about how we decided to go about doing what we did.
Thank you, Alaa. Dr. Sigmund, right before I get to you, just one more quick question for Alaa. So you mentioned that Welcoming Pittsburgh is an initiative of Mayor Bill Peduto. So is My Brother's Keeper as well, with County Executive Fitzgerald. And in the Office of Equity, these are two kind of community engagement related initiatives, and we engage with the community a lot. And quite frankly, the Office of Equity is an evolution on what the mayor's vision had been around the Bureau of Neighborhood Empowerment, which is how the mayor's office and city government, but how the mayor's office can be good partners with individual neighborhoods. In speaking about this collaboration, how do you think about your role? Like, how do you think about the role of us as a city, and then us as initiative leads in this kind of collaboration?
Thanks, Josiah. So yeah, to clarify and talk a little bit more about Welcoming Pittsburgh, Welcoming Pittsburgh is like the community arm of the Immigrant and Refugee Inclusion Initiative at the mayor's office. And one of the things that we do is we convene the community, specifically stakeholders who do who are doing this work every single day. And we convene them, right now we convene every other week, and we do a lot of work together to try to tackle a variety of different issues that come up for this specific community. But if anyone wants to learn a little bit about what Welcoming Pittsburgh and all of our wonderful community members are up to, they could visit our website and they can learn about the Welcoming Pittsburgh plan, and they can actually go to see our tracker and find out exactly what we're up to, where we are in accomplishing this plan, who we're working with, all the key leaders, some of whom are on this call right now. And so when it comes to education around COVID-19, I see the role of government as like a convening body and a body that is there to provide resources. And so in many ways, Dr. Sigmund and the rest of the executive committee that convened to put together this initiative, they're the ones that helped lead this. They're the ones that put this together and did the work. I was there to hear about, what do you need this week? What kind of resources can the mayor's office do to support you? And I think that, like I said earlier, specifically with this kind of campaign where it needed to be community-led and the faces of community members needed to be at the lead. The only thing that government can do at this point is to provide resources and listen. So that's kind of what we tried to do.
Yeah, thank you so much. And I do encourage people to check out Welcoming Pittsburgh online, and you will see dozens of specific objectives related to the initiative and milestones. Also, you can look at Welcoming America and see how this work looks around the nation. And I may be biased, but we've got a pretty cool thing going here. Let's turn to our community partners. We have such a great opportunity to hear directly from them. Dr. Cathy, thank you so much for taking the time today. I'd love for you to share a little bit about the Health Center, if you feel willing, and then talk to us about how this particular campaign came about.
Yeah, so Northside Christian Health Center has been around for 26, 27 years right here on the North Side. It was planted and founded by 3 docs, 2 of which went to Allegheny Center Alliance Church that also served as like a co-planting entity. And the mission was really a medical mission to reach the most vulnerable, the most marginalized, and to help the community develop healthy community strategies. We provide primary health care, we provide dental care, behavioral health care and love to partner with our community. And it's been, I tell you, it's been just a wonderful opportunity and blessing to partner with the mayor's office, particularly working with Alaa, who has been the glue in so many instances as folks from various places got together with this Quiet Care campaign. She helped us organize and help us move forward when we got stuck. And so thank you so much for all your help and for just pulling us together. So this has been such a joyous venture. The Quiet Care campaign actually started a little bit, it's like a convening or convergence of a couple of different things. One, Alaa has just mentioned. The other had to do with the Embrace network that I mentioned earlier on. So Embrace is a network of churches, faith-based organizations that have come together to minister and to serve our global community right here in our neighborhoods. And so we love working with refugee immigrant groups, and I actually met everybody else on the line here through Embrace as we came together. And so as COVID-19 began to gain traction, negative traction, we were concerned about our friends, our immigrant friends who had language challenges, cultural challenges, and whatnot. And so we started to conceptualize a culturally informed COVID-19 education and safety strategy developed by the community for the community. And so in working with a number of African immigrant groups, we felt it was important to have African leadership at the table as we develop strategies. In working with African Americans, we felt it important to have that type of leadership at the table as we develop strategies. And so we know in many of our communities, stigma is such a significant health barrier, not just to COVID-19, but to other types of health issues. And so we birthed this Quiet Care campaign out of this culturally sensitive strategy. And QUIET is an acronym that stands for Quickly Initiating Essential Testing Around COVID-19. And that was the main objective of our strategy, as well as the education piece was very, very important. The executive committee, Alaa has just mentioned, we came together as leadership from the African American community. We had Reverend Greg from Project Destiny, from other African communities. We've had Dr. Williams, which is from Ajapo, she's Nigerian, and it was just such a beautiful bringing together thereof and recognition of the differences, but also similarities in that we were all at high risk for COVID-19. And so we have some really great news that I will share towards the end, but just the coming together and brainstorming how we were going to tackle this problem was a significant opportunity, challenge, but also helped to bring us together as an executive committee to serve our communities.
Thank you so much, Dr. Cathy. Siraji, I'd like to turn to you, man. It's been a while, man, since we last talked on the North Shore. It's really good to see your face, to have a chance to collaborate like this during a global pandemic, bro. If you had told us, if you told the two of us that this would be the case, we'd have a lot of questions, I think. I'd love that could you talk a little bit about your somali and the role that you play there, and then I'll ask some questions about COVID-19.
Yeah, so my community, I serve the Somali Bantu community in the Northview Heights area and little scattered neighborhoods in Bellevue, Crafton Heights, and Sharpsburg. I am the executive director of United Somali Bantu Greater Pittsburgh. And what the challenges when first COVID-19 hit was like, how do we know, right? The language barrier was the first thing. Like they didn't understand what COVID-19 was. They didn't know what the seriousness, they didn't know the level of seriousness it was and what they needed to do to stay safe, right? It was all in English, but it's like it needed to be carried around word of mouth. So in our community, we kept on having a hard time letting people know like people listening to at the same time. Like it's like you're letting them know, hey, you need to stay safe by having a mask, a glove on for a certain points, gloves on, masks on, staying 6 feet away. It was just they weren't taking that as serious, and it was like a somewhat a cultural thing. Like gathering was the most issues. Like they couldn't stay. It's like it was that important thing that when families have something, it's gathering was a big thing. So with that, it was just like we need to distance ourselves when we're gathering, and we have to have certain limited numbers of people in that gathering areas. So it was just like getting the concept, like having them get used to the concept of socially distancing and having a mask on, washing their hands or having gloves on. So it was really, really difficult for us to get the word out, because it was like somebody says, one person says something and the other person says something else. So it's like they kept on having that issue of who do we follow or who do we believe that is telling the truth. So that's what I have been in navigating that in my community. Is just, hey, like this is what it is. If you need proof, is I have a letter and you could just read it, and that's the same thing that I'm following. I'm telling you.
So it sounds like you were playing an important role of talking with folks within the community about COVID as information is evolving and changing itself. What were the primary sources of information? Were folks hearing things on the news? Was it stuff on social media? What was it?
Folks was primary hearing sources on the news, and then all of us, like it's in the immigrant community, WhatsApp is the biggest thing. So certain people hear in the news and then pass it along on WhatsApp, and then some words, it was like a telephone game. It's like some words weren't translated like what's the CDC guidelines were and what they heard from the news. So it's like one person says something else, and just down the line, it's a different story or a different information. So it's like we had to correct that in a certain way. So mainly was the media, the news, and WhatsApp.
Got it. And were you able to find PPE? Were you able to get supplies? And
thanks to Sergeant Tiffany Cost at the Pittsburgh Police. She's been helping me navigate with Global Links, getting me some gloves, mask on, and Dr. Cathy Sigmund helping me with everything that I just needed. Like it was just, I had so much support that it was just a phone call away. I could just call Alaa and she could just tell me just, hey, like, let me get that for you. I'm going to contact somebody that could help you with that. And it's just like every phone call, it made it so much easier on my end just to make a phone call. And that phone call, like I had a whole bunch of resources there, and like somebody was already at the end of the line just waiting for me to make that phone call to help me with that. So it was a blessing, and it was just the easiest transition that I ever had.
And I would just say, I mean, every time I talk to Siraji on the phone, he's on the go, i.e. he's currently in his car, was driving moments ago, and he's on his way to help his community in one way or the other. So
it's always like this is what I'm doing now. It's like I am trying to give out like boxes of food to families, and I'm in the car while I'm looking at people taking boxes.
Well, we really appreciate you, and thank you for taking the time. It's so great to talk with you. I think we have been trying to reconnect. So, Dr. Cathy, I'd like to turn to you. I'd like to know, how does this start coming across your radar? I remember for myself, towards the end of the winter, February going into March, we were hearing more and more about COVID, and it wasn't exactly clear how impacted we would be or how serious it was, and certainly. Information about COVID has evolved over time as we've learned more about the virus. You're someone that's already tremendously involved with community in a number of ways. How did kind of COVID come across your radar? And then how did the situation in Northview Heights come onto your radar?
That's an excellent question. At first, it came across my radar like everybody else, listening to the news and hearing the various stories. And then personally having family members that had COVID-19, and then hearing about our global community here in the greater Pittsburgh area with folks coming down with COVID-19, and then Wasi noting about the Somali Bantu community with COVID-19. And we were like, hey, we have got to get this together. Northside Christian Health Center is a federally qualified health center. That means we get funds from the federal government. We work very closely with state and county government in these type of initiatives, these really significant public health matters. And so we had self-site swab tests, like we were one of the first groups with other FQHCs, and there are a number across the greater Pittsburgh area that have self-swab tests, not the horrible, nose tests that people were, really turning people away. And so we had all the supplies. It's like, how do we get it out to folks? And so when the executive committee came together with WASI and then with Buell Foundation funding this project, we were able to mobilize with the leadership from the community to get not just the word out about what needs to happen with COVID-19 and social distancing and the mask, as Siraji just mentioned, but gathering the community leaders to find out what's going on in their communities, and then jointly together strategizing about, okay, so this is how we're going to provide services with the Somali Bantu, and then with the Congolese, and then with the Burundians and other groups. And so it really was a collaborative effort to get the word out. But what was very, very concerning with African Americans and the other African populations was the fact that we're at such high risk for hospitalization, such at high risk for, in the health centers, at high risk for death of COVID-19. And so it was an urgency that really brought us together, and it pulled this whole thing on our radar at Northside Christian Health Center.
Thank you so much. Benoit, we'll go to you. I think I see there. Okay, you're still a guy, man. I couldn't tell if you were just looking off pensively into the distance or frozen. Thank you for taking the time. Can you hear me all right?
Yeah, I can hear you.
Terrific. So my question is to you, man. You don't live in Northview Heights, and so I'm curious how you were made aware of what was going on there, and then what compelled you to get involved and what that's been like.
Well, just so you know, real quick, I want to thank Dr. Sigmund, because she's the one who got in touch with me. Just so you know, a long story cut short, last year, she's one of the people that took me Northview Heights, because she heard about me through my regular job. And that kind of raised something in me. She planted a seed, and I wanted to up my people, and I got elected last year as the leader of the Congolese community in Pittsburgh. So when she came to me with this idea, I was like, great, I want to get involved. I want to do it, even though I don't live in Northview Heights. But most of my people are there, Northview Heights, Crafton, and a little bit scattered. The rest are a little bit scattered all through the Pittsburgh area. So to get back to your question, why did I jump in? So I'm a strong believer that as a leader, every leader needs to understand the really needs of the people. It's very important, Like a wise man told me once that most people in leadership don't make the right decision or bring the appropriate up to the people because they don't have the right information. So I felt compelled to go to this and then put my boots and be on the ground with my people to try to understand them, talk to them. So that's the reason why I actually accepted the challenge. It was a good challenge, but everything went well.
Yeah, certainly in my lifetime, an unprecedented challenge. What was the experience like for you when you got on the ground? What are some of your reflections on how it was when you first started to encounter it, and then since then?
It was exciting. Well, it was COVID, and Dr. Sigmund made sure she was like, "You guys make phone calls. You don't need to go on the ground." But in our culture, people lack that face-to-face interaction. All right. So I had kind of a dilemma because I have elderly parents and I have a 1-year baby in the house. I was like, okay, I'm not going to do this. All right. But I was like, I talked to my wife. I was like, you know what? I need to be on the ground. I need to do this. It's for the better of our Congolese community, not just that, but our big community, which is Pittsburgh. All right. So people were very excited to see their leader because we didn't have that many chances to meet, like meetings, you know what I mean? So it was, like I said, it was beautiful in a sense, but in the other end, something I want to add, and I think will help us out moving forward, if we want to keep on doing programs like this, is culturally, I believe that's most like African, we're like that. Maybe Siraji, my term is different, right? We are not used to go to the doctors unless we are very ill, So coming to them with all the COVID was kind of hard to actually have them like move forward and do testing, So they needed that reassuring. So they need more of an education portion of what we are doing. So coming out of that, I'm very excited because I actually understand what the Congolese people here in Pittsburgh or the immigrant need. They need more of the educational program to help them move forward, to help them be healthier, to help them be more citizen, a better citizen in our city. So I hope I answer your question.
Thank you, and congratulations on your election. Siraji, I see you nodding and smiling. You resonate with what Benoit is saying there about how it was on the ground?
Yeah, so before even Dr. Cathy started the whole quiet campaign, I was already on the ground, just running around, just like as soon as COVID-19 started, the kids were out of school. I was running around first based on like finding resources for families because they needed all the help they could get because everywhere was closed, right? All the supermarkets were getting emptied out because everybody was panicking. And so I was already boots on the ground, helping out with that resources, then coming to find out that there was a community member in our community that caught the virus. So it's like, so I had to go easily, like, so what do I do? Like, how do I transition into playing this role, not as a doctor, but as a community, just like a community activist, just helping, like being a voice for that person and better educating them, right? A family member does not just go like within the African community. Somebody just don't go to the hospital like just like that. If they have a cold, they don't run to the hospital and say I have a cold. They stick with it until it's like it's a serious illness, and then they were like, yeah, let me go get this checked out. But it's not just an easy thing. Hey, like go get checked out just in case if you got it or not, if you contracted the virus or not. So that was the hardest part, right? This lady, the person that caught the virus, didn't know she caught the virus, but I knew the symptoms. But then it was like, okay, she was new to Pittsburgh, everything was new. So it's like, how do I navigate that? How do I help her with that? I asked her, hey, let's go to the hospital. Let's take you to the hospital. She was like, no, like I'm not going to the hospital. So it's like those kind of things, like I had to persuade, like this is important. This is for your health. It's I'd rather see you alive than see you gone, right? I'm like, let me do my best to keep you healthy. And then what after that you can make your own choices. But let me just get you checked out and make you feel more comfortable. Because right now it's like you're feeling not so great and you need all the attention that you can get. So let's just get you what you need help with, and then we could go from there. But then it just got it. Once somebody heard it in our community that someone has COVID, it just went on. Everybody was just keeping distance from that person. They were like, oh, don't come near me. Don't like, they just closed that person out, right? It was, that's the issue that we got, is certain type of viruses or diseases like we in our community is frowned upon. It's not talked about, it's not discussed, or it's never acknowledged, right? So it's always kept down on the low. It's like whoever has a virus, like you keep it to yourself. And if somebody finds out, like it's just a done deal. Like that person's never gonna look at you the same. So with those kind of things, like it's just like it was just hard, and still today, it's culturally it's different, right? So we can't I try to make them as easy. I try to make it as easy as I can for them. It's like it's your choice at the end of the day, but I'm gonna give you all the options you got, right? If you need my help, just let me know. Then I'll help you from there. We'll make a plan to go forward from there. But I'll give you all the options. I'm not gonna force you, but I'll give you all the options. And that's what I gave everybody. Hey, like I'm giving you this option. This is what is out there for you. And if you want it, let me know. If you don't, I'm not pressuring you. There's no pressure. So it's like those certain kind of things. And if you do got the virus, like please keep it. Just isolate yourself for a while. And that was the hard thing, to isolate for a while, because in our culturally speaking, we got comfortable of seeing family constantly, like having family over. So having that closed out was a struggle, and it was a big struggle. It was a big struggle in our community, and we couldn't. It was just hard. I'm like, please just try your best to keep that away. Like, try your best to keep it isolated, keep yourself isolated, and keep yourself healthy and safe, and don't give it out to anybody. Even though that it was hard, like it's kind of passed around, but we kept it. I tried to educate everybody just to keep it safe, just to have everything, take extra precautions, extra things that they needed. And I gave them supplies, like as much as I had, right? When COVID first hit, everybody was scrambling for anything. So it's like whatever that Global Links had for me and Dr. Cathy had for me, that was all. And I try to give it out to as much as possible to families that needed the most, and hygiene supplies that families needed the most. So it's hard until right now. Like people are still not getting that concept in their head that it's still here, and it's still gonna get worse before it gets better.
Still here. We're so fortunate to have you all as leaders in our community. That much is clear. Dr. Cathy, let's talk about the Quiet Care campaign. Let's just jump right into it. What is the structure? How is it like systematized? And then what have the findings been? What's the road been like?
Okay, so the Quiet Care campaign is built off of an executive committee. And the executive committee included Dr. Yinka Williams from Ajapo, Kier Mugawinza, I can never pronounce his name. Sorry, Kier, sorry. Muga Nisa, somebody help me out. I know you guys. Yeah, so sorry, Kier, please forgive me. I always say that to him. He's a dear friend, and from Allegheny Health Network Center for Inclusive Health. You have Benedict Kalan from the Allegheny County, Alaa, and also Reverend Greg from Project Destiny, which provided the core of the committee. Now, the committee was very, very important in getting us with the other community leaders that we would be working with. They served as a governance committee, not quite board, but governance. They reviewed our cultural survey, our cultural belief survey for COVID-19. They looked over all of our procedures and protocols. So they were very, very important. The community leaders, though, were the arms, the legs, the feet that mobilized our initiative. Now, our initiative, we have two of the community leaders, obviously Ben and Siraji, but there was also Fato Amada from the Somali Bantu Community Association and Adisa Bakuru from the Burundi Association. They were also community health workers that actually made the contact with community members. And so, as you heard Siraji mention, there's a lot of stigma around health issues. And given the stigma around health issues, we had to have an understanding of the cultural belief system that the folks had. So we put together a cultural belief scale that was reviewed by the community members as well as the leadership. And we're going to shift to that in a minute, in looking at some of the outcomes. But the importance of the cultural belief scale was that if you have no sense of what people are thinking about a disease or about a health condition, you're not going to know how to intervene. And so we heard all sorts of stories, just like Siraji was mentioning, all sorts of stories from the community. My first story came from an African-American woman who, when we were out there, Northside Christian Health Center was out doing the self-swab COVID-19 tests. And she was like, what are you doing? We said, oh, we're doing self-swab. Why don't you come get tested? And she was like, don't they give you COVID-19 when they give you the test? And we're like, of course not. That's not. But she said, everybody's saying that. And so there are all sorts of beliefs out there that we had to negotiate and get around in terms of encouraging people to get tests and also to do the social distancing and to wear the mask. And so we gave a cultural test, this survey that was given out through the community leaders to as many African Americans and other African groups. And then we did a community education piece where we told them, well, this is what the CDC says. This is what you need to do. And I think that's what Siraji was mentioning when he said, he showed her a letter. These are all sorts of things that you need to do to stay safe. And then we did kind of like a post-test question. What did you learn? And it's amazing the kind of beliefs that were out there, but also the kind of information folks learned and were very happy for related to COVID-19. And if I could, I would like to share some of that information, share some of that data from the community. All right, so let's see if we can get this up and going fairly quickly. And here we have it. So the purpose of our cultural belief survey was to assess cultural beliefs and conceptions about COVID-19, to look at where are people getting their information about COVID-19, to look at knowledge of where to go for COVID-19 tests and importance of wearing masks and social distancing. And what did we find? We found that, and this is, I should probably have it on slideshow. Sorry about this, folks. There we go.
Terrific.
So we found that there were some differences in nationality. So we're dealing with a primarily African descent population, including African Americans, Burundians, Congolese, Somali Bantu. And we found that the great majority of folks got their information from the news, if you're talking about the Somali Bantu, or Congolese, from families and friends, from the Burundians, from friends and family, and African Americans from, sorry about that. Oh my goodness, sorry. From friends, family, and news as well. The other thing was the concern about catching COVID-19 and getting sick from it. 59% of the participants felt that it was a serious concern, very serious concern, or somewhat worried and concerned about catching COVID-19. And there's a time comparison too. Earlier on, people were more likely to be afraid of catching COVID-19. Earlier on, it was 65% of participants that took the survey that were worried about catching COVID-19, as compared to only 52% of the participants after, I think the delineator was August the 7th. So if it was before August, early August, there was a lot more worry and concern than after August, where people are getting used to it, but still a lot of concern. 52% of the folks were like very, very concerned. There were differences in nationality in being concerned about COVID-19. With the Somali Bantu saying that they were very, very concerned. Americans, 57% of Americans were concerned, 56% of Burundians, and on it goes. So we were very interested in the differences among the people groups.
Dr. Cathy, how often was this survey given?
As often as our leaders could tell you, as often as they could give the survey. It's based on, the information I'm giving you now is based on about 300 individuals. 200 of them are African American, and about 100 of them are, no, it's more than 100. So it's about maybe it's not split, it's like 2/3 of, it's about, 200 African American, about 100 of African descent, including the 3 people groups that I mentioned before, the Somali Bantu, the Congolese, and the Burundians. And so we gave it out as much as possible through the community leaders, whether it was face-to-face, as Ben mentioned, or on the phone, as Siraji mentioned. It was given out as much as possible.
And when did you start with it?
Collecting data, not until the top of July. So
Okay.
this data is between July and August, and then after August until like late September.
Wow. So you're getting, 7, 8 times responses from folks in some cases.
Yeah. And so no, as we only interviewed each person like once, but looking at the timeline of the data, we can tell like earlier on people were more concerned versus later on people had, less concerns about COVID-19.
Thank you.
One useful fact, and I'm trying to watch our time here, is that it seems among all the groups, wearing masks were important and social distancing were important, but you do see ethnic differences or cultural differences among the African Americans that are like 82% compared to like the Burundians are only like 61%, and then the Somali Bantu and Congolese were somewhere in the middle. But for the most part, everybody thought that was important. Same thing with social distancing. That was also important, about comparable numbers. Now, this slide really captured some really interesting information. And these are common beliefs about COVID-19 among the various people groups. And so one of the common belief, regardless of whether they were African American or Burundian or Somali Bantu, is that COVID-19 was a punishment from God. So about 18% of people believe that. And they believe that it was a punishment for God because we don't do right in this world. And another interesting fact is that if you do a similar survey among the majority population, that's not such a different response. There are other people that believe it's a punishment. Okay, another fact, whether you are around only a few people or many people, the risk of COVID-19 is the same. So about 16% of the population that we studied thought that was true. Another interesting fact, even if you wash your hands and wear a mask, social distance, you can still get COVID-19 if you're meant to get it. So it's almost like a karma sort of thing. If you're meant to get it, you're going to get it anyway. Other sorts of beliefs are represented down on this thing, which is similar to above, but the numbers are a bit higher because this is the person saying what I believe versus what other people around me believe. The most exciting bit of information that we have is that 66% of all of our participants said they learned something. And so that was the main reason why we did the survey, because we wanted to educate the folks that we were working with. And so you can see some of the responses on the slide. A lot of people learned information about what are the testing sites, where are the testing sites, and what are the times of testing. They learned information about social distancing, about wearing masks, about how the COVID-19 virus is transmitted, and why it's important to social distance and why it's important to wear a mask. They learned the differences between the types of masks. Like an N95 has a whole bunch more protection than a regular cloth mask or a regular paper mask. So it was a wonderful experience to work with our community partners. It was really rewarding to know that we help people. We don't know, maybe we even saved some folks from getting COVID-19 and maybe saved lives. But working together with our Department of Public Health as well, I should have mentioned that earlier on, Dr. Bogan has been instrumental in reviewing our questions too and providing information for us. And so this is very, very exciting, as well as rewarding to have worked with the communities, the mayor's office, and our county in this project. And this is the last slide shows the breakdown of nationality and what people believe they learned. Like the Somali Bantu participants, 100% said they learned something. Congolese, 89%, the Americans, 69%, the Burundians, it's 41%. Not so sure why they're 41%, and the others are more than that. But yeah, so it was just very, very rewarding.
That's terrific. Thank you so much for walking us through these data. Is there anything else you'd like to share on the screen?
No, that's
okay.
Good.
So I'd love to know, what does the pathway forward look like? Where do we go from here?
We, as the executive committee, as well as our partners, would like to take the lessons learned from the Quiet Care campaign and the African and African American communities and share it with other refugee immigrant communities and other minority communities. And so most recently, we had a conversation with Dr. Bogan and working with Bhutanese, the Bhutanese community here in the greater Pittsburgh area, and they're very excited. So we'll be doing translation of the Quiet Care survey that I mentioned, working with that community on what strategies they believe is most useful for their community. And moving forward throughout the various communities. Arabic speaking community is another one that we work very closely with and wanting to move forward with this campaign.
This is really terrific. I'd like to ask a question about a phrase you used at the beginning, which I'm resonating very strongly with. You said culturally informed. And I hear culturally competent, a lot, certainly something that a lot of folks keep in mind. But yet sometimes I find that people use cultural competence as some kind of check mark that they have accomplished, and they go in with a sense that they are culturally competent with whatever prescriptive sense of what they're going to do. And yet what I hear from you, it seems to be a little bit of a difference there, and the approach of checking to see what folks know about, checking in on learning and all this stuff seems to be a bit different, maybe a little bit more nuanced. Could you just speak to it and why it's important?
Absolutely. That's the core of our campaign. We realize that no matter how much book knowledge, and I can tell you I have a lot of book knowledge about it, it is not comparable to real life experience and being of that ethnicity and being of a particular culture. I find it extremely disrespectful. So I'm going to go into my little passion area too, and I'm going to try to not be so passionate.
We got time. Go ahead.
Disrespectful for people who are highly educated to think that they know what's in the best interest of all these other people groups. I mean, and it's throughout my years, and I've been at this for quite some time, and I'm going to put it online, 35 years of this. My background is as a clinical psychologist, a cultural psychologist, and there's no way would I say, I know the Burundian people, I know the Congolese people, I know even African Americans. I mean, there's no way, because there's different ways that we see these sorts of things. And so it's imperative that we are informed by the people we serve concerning those strategies they believe that are important to their communities. There's just no way. We should move forward that way. And I'll give you another example of that. One of my other little pet peeves is this whole idea of Blackness and Black Americans. I mean, so I'm appalled, and I'll just say it, as a person of African American descent and other descent, I'm appalled that in science and medicine, all people of any type of African descent are pulled together as if we're just one big group. That's disrespectful. I have conversations with my African descendant friends and whatever, and we're all on, most of the time, we're all on the same page about this concept of, what do you mean by Black? That's a color coming out of a Crayola box from my standpoint. And I know it's probably a touchy subject to some, but I'm arguing for the notion of ethnicity and culture being forefront, especially in discussions of health. And I'm trying to get a sense of health strategies, health beliefs, as well as the idea of what can be traumatizing to a person in regards to culture and ethnicity. And so I advocate for the use of Congolese American as Ben would say, Ben would know. I advocate for Somali Bantu American, as Siraji would know. And although we share some cultural features, there are differences. And I think it's disrespectful of us as Americans in general to assume we understand other people's culture as we would understand our own.
I hear you, and I appreciate that so very much. And I just have to say, I'm so thrilled to know that this approach is being taken in our city and region.
Absolutely.
And I know we have a lot of work to do, but what an encouraging thought. Siraji and Benoit, I'd like to go to you as we bring this conversation to a close. Any reflections that you have on the conversation so far? But I'm curious about a little chance to be culturally informed even on this call. What would you like folks to take away from about your community and your communities as you define it? What would you like people to know? Anything that comes to mind. And Benoit, I see that you're unmuted. We can start with you, sir.
Okay, no problem. So if I understand your question, you would like to know what people should take away from this conversation, right?
Yes, please.
All right, I will say this, and I will piggyback right for what Dr. Sigmund say. First of all, Congolese people are very welcoming people. We most of the people that came here as refugee, as student, and come here to look for a better life. We are not here to come like some people will say, take people jobs. We came here for a better opportunity and to be good citizen. All right. And I strongly believe that learning our culture, like let's just say Dr. Sigmund say, right? I'll give a simple example. I was born and raised in Kinshasa, which is the capital of the Congo, and we have about 400 dialects spoken in the Congo, right? So being a leader of this group, one of the big challenges is trying to understand my own people, culture. So I'm learning a culture within my culture, all right? So with that said, it's not gonna be easy for all of us to just embrace the Pittsburgh culture, because Pittsburgh have a culture, or even the United States culture, right? It's not gonna take time. That's why I would like for everybody, like from our community, right? Especially from our community, I would like people to, the city and everybody else, everybody I will partnership with, to try to build a lot of more educational program to help us become good citizens of United States of America, of the beautiful city of Pittsburgh. We really want to fit. We really want to be a part of this community. Like there's a lot of those youth, like myself, going to school, having degrees, but it doesn't change that Dr. Sigmund said, the fact that we need to each way, right? African American, African Congolese, African descent, all that stuff, to trying to learn a little bit of each other culture and together move forward. So that's what I can say. We open to partnership with anybody because, the oldest Congolese in Pittsburgh, I think have been here for 30 years. We're one of the oldest African community here. But this is what I feel. I feel like we have been stuck because of that. Learning the culture, more educational program, learning the language. So we need to bust that bubble. So I'm asking here in this venue for anybody to come and actually work with us. Help us, help you guys, help us, help the city to become better. The only way to do it is that more educational program. Thank you very much.
Thank you, sir. And I hope that our paths cross in person very soon. I'm going to take you up on that offer. Absolutely. Siraji, same to you, man.
Yeah, so I'm going to piggyback on what Benoit just said. Don't categorize us in one box, right? We are all different. So let's just not just say Africans, they're all Africans, right? There's different type of Africans in Africa itself. Africa is it's a big continent, right? There are different people in Africa. So for us, like I am from Eastern Africa, I'm Somali Bantu, but there's Congolese Africa, there's Burundi Africa, right? We all are not, we're somewhat the same, but we all have different cultures, different languages, different dialects of languages that we speak. So it's not just, let's not categorize just Africa as one. We are as one, but we have different uniques. We have different aspects of things, of way of life. So let's not have a closed mind, but have an open mind and work together. And if you want to learn about me, we could do that. Let's learn about each other, right? We're always here to educate others about how different we are. And we want you guys to educate us of how different you are. So it's a learning cycle for all of us. So let's learn together instead of just having that closed-minded mind and just focusing on one thing, not the bigger picture. We came here to have a better life, but we're not here to take anybody's place. We're here to make our own place. And this is what we call home.
Well, my friend, there is room for you, and we are so happy to have you here. You know, it reminds me of, I had a job when I first started working in the city with Meals on Wheels, and we were based, when we first started, out of the Carrick community. And I had Route 3, and I was talking to some of the volunteers one day about something that had happened in the route. And I remember very distinctly, the volunteer stopped me and said, that's not Carrick. Those are Hilltop people. Which to me was, at the time, was very, very, very close and seemingly the same neighborhood. But they were very clear that that there's differences between the neighborhoods. And I think that honoring those differences makes all the sense in the world. And thank you all so much for voicing that so beautifully and so personally. Any final reflections or encouragements from all of you on the call? Open up one last time for anything else that might be on your heart to say.
I just want to say I have learned a lot from the people on this call, but also just the rest. There's a lot of people that aren't represented on this call that helped make this initiative possible. And I also want to say that our initiative is not the only initiative in the city that is addressing these concerns. Like I said, this group focused on the Northview Heights region. There are other people who focused on places all over the city, including Father Abernathy, working with one of the resettlement agencies, JFCS, Jewish Family and Community Services. There is actually a New York Times article that came out last week. We were like front page headline that covered some of that other work that and some of the ongoing challenges that other groups in our city are facing right now around COVID-19 education. And so just wanted to say thank you to everyone here, and also add that the work that Dr. Sigmund referred to earlier around racial sensitivity, ethnicity versus race. Those are conversations that we are continuing to have within the Welcoming Pittsburgh initiative. And so if anyone is trying to reach, whether it's Benoit, Dr. Sigmund, Siraji, or myself, or if you would like to get involved in these conversations, please feel free to email us and we'll happily connect you to the right people. You can reach us at welcomingpgh@pittsburghpa.gov. Thank you.
Thank you so much for that, Alaa. I hope people are feeling the same sense of encouragement that I'm feeling. Certainly a reminder that challenges remain in a lot of different ways, and certainly COVID-19 remains a serious concern. We are still in the midst of a global pandemic, but it's been our great honor to talk about the Quiet Care campaign and this specific collaboration, to Alaa's point, one of many that are happening around the city. We also encourage folks to look at those other organizations, the ones represented on the call and those that have been mentioned. Want to mention AJAPO, want to mention the Neighborhood Resilience Project, which is where Father Paul Abernathy works that Alaa just mentioned. And a lot of really great organizations doing incredible work that we could spend many hours talking to and about. But anyways, please take care of yourselves. We're going to continue to do this equity series and talk about work within the city and in partnership. And we have just really enjoyed this format because of this kind of conversation where we get to just learn about what's happening on the ground through the voices and the passion and the identities of those that are serving our community so very well. So until then, like I said, please take the very best care of yourselves, and we'll see you next time.